At Greiner Bayer 1, our focus is on safety. This video illustrates the proper use of the VACUETTE QUICKSHIELD Complete Plus. The device is a pre-assembled VACUETTE QUICKSHIELD safety tube holder with a VACUETTE Visio Plus needle. Safety features of this device include a VACUETTE Visio Plus needle pre-threaded into the safety holder, which saves assembly time, a rotational safety shield to secure the needle after activation, a translucent hub on the needle which provides a visual flash when vein penetration is achieved, an audible click letting you know the safety feature has been properly and fully activated. We are confident that you will find the VACUETTE QUICKSHIELD Complete Plus safe, convenient, and easy to use. Now let's demonstrate the use of the VACUETTE QUICKSHIELD Complete Plus on a patient in a clinical setting. Open the package by lifting the paper from the plastic at the indicator. Be careful not to bend the needle when removing it from the package. Locate the dot on the needle cap. This dot indicates the bevel up position of the needle. If desired, the shield can now be rotated to the preferred position on the holder where it remains stable during venipuncture. Place the patient's arm in a downward position, apply the tourniquet, and prepare the venipuncture site with appropriate antiseptic. Immediately prior to the needle insertion, remove the protective needle cap. The bevel will be in the up position with the safety shield oriented to the preferred position. With the thumb of your free hand, pull downward from below puncture side to anchor the vein and stretch the skin. Inform the patient of the imminent stick and with bevel side up, insert the needle into the vein at a 30-degree angle or less with a steady advance. Once the vein is accessed, a flash of blood will appear in the view window of the needle hub. Put the first tube to be filled into the tube holder and advance it onto the interior needle so that it punctures the stopper and blood enters the tube. Release the tourniquet once blood flow is established. Hold the tube in place by pressing it with the thumb to ensure a complete vacuum draw. Underfilling tubes may affect sample integrity and alter test results. After the tube has been filled, remove it and immediately invert it several times so that the blood properly mixes with the additive. If multiple tubes are required, insert the next tube according to the proper order of draw and repeat this process until all tubes are filled. When all samples have been obtained, place a gauze pad over the insertion site without applying pressure. Remove the needle from the vein. Apply pressure to the puncture site. Activate the safety shield by gently pressing the shield towards the needle on a stable surface. Thumb activation is also possible, whereby the thumb should remain behind the shield at all times. The VACUETTE QUICKSHIELD Complete Plus is now fully activated, protecting the user and all waste handlers from exposure and possibly accidental needle stick injuries. Discard the entire assembly into a sharps container. Once bleeding stops, apply a bandage to the site. To summarize the use of the VACUETTE QUICKSHIELD Complete Plus, locate the dot on the protective needle cap to determine the location of the bevel. If desired, rotate the shield to the preferred position. Apply a tourniquet and prepare the puncture site. Remove the protective needle cap. Anchor the vein by pulling from below the intended puncture site with the thumb of your free hand. Insert the needle at a 30-degree angle or less with a steady advance. When the bevel is in the lumen of the vein, a flash of blood will appear in the view window of the needle hub. Insert the first tube into the tube holder and allow it to fill. Release the tourniquet once blood flow is established. Remove and invert the tube. Repeat with other tubes as needed. Place a gauze pad over the insertion site without applying pressure. Remove the needle from the vein. Apply pressure to the puncture site. Activate the safety shield by using a hard surface or your thumb to press the shield toward the needle until a click is heard, always keeping your fingers behind the shield. Discard the device into a sharps container. Once bleeding stops, apply a bandage to the site. Thank you for choosing the VACUETTE QUICKSHIELD Complete Plus. VACUETTE QUICKSHIELD Complete Plus is a medical device. Please observe the instructions for use 980249, which can be downloaded from our website www.gbo.com/preanalytics. VACUETTE is a registered trademark of Greiner Bio 1 International AG.